Ever had that weird feeling where you're looking straight ahead, totally fine, but the sides just sort of close in?
Yeah, like you've got blinkers on almost.
Exactly. That's what we're digging into today. Tunnel vision. We've got some really focused revision notes here.
Right.
And the plan is to give you the essential facts, fast but clear. We'll cover the definition, causes, risks, how it happens.
What else it might be, how common it is.
Yep. Plus how it shows up, tests, treatments, the outlook, and any knock-on effects. Basically, your quick guide to tunnel vision.
Okay, sounds good. So, definition first. At its core, tunnel vision is pretty much what it sounds like. Your visual field narrows.
But the central bit stays clear.
Usually, yes.
Mm-hmm.
Central vision is fine, but the peripheral, the side vision, is lost. The notes had a good way of putting it.
Ah, yeah, the looking through a tunnel analogy.
Exactly that. Simple, but effective.
Makes sense. So, okay, what actually causes this? What are the usual suspects?
We can sort of group them to make it a bit easier. Maybe think eyes, nerves, brain, and then others.
Eyes, nerves, brain, others.
Okay, so for eyes, you've got conditions like retinitis pigmentosa. That's a genetic thing affecting the retina.
Yeah.
And, of course, glaucoma.
Glaucoma comes up a lot, doesn't it? Linked to eye pressure damaging the nerve.
Precisely. Then for nerves, you're looking at direct optic nerve damage. Things like optic neuritis, papilledema, even some infections like retinitis,
Got it. And brain.
brain lesions, tumors, basically anything affecting the visual pathways in the brain.
Right. And others.
That's kind of a catch-all. Certain medications can do it, drug toxicity, things like that.
Okay, eyes, nerves, brain, others. Helpful way to frame it. So who's more likely to get this? What increases the risk?
Well, it ties back to those causes, really. If you have one of those underlying conditions like retinitis pigmentosa, your risk is higher.
Makes sense.
Family history plays a part too, especially for genetic conditions, and definitely a history of glaucoma. Exposure to certain toxins or meds is another one.
Right. Now let's go a bit deeper. How does this actually happen in the body? The pathophysiology.
Fundamentally, it's about a disruption somewhere along the visual pathway. So either the cells in the retina aren't working right,
The light detecting ones?
yeah, or the signals aren't getting through the optic nerve properly, or there's a problem in the brain where those signals are processed.
So the message from the side gets lost somewhere along the line.
Pretty much. The end result is less visual info coming from the periphery.
Okay. So if someone comes in with this narrowed vision, what else might be going on? The differential diagnosis.
Good point. You got to think about other things that cause peripheral loss. Again, think eyes, nerves, brain. Glaucoma is definitely high on the list.
Because it often starts with peripheral loss.
Exactly. But also other optic nerve issues, neuropathies. Brain tumors affecting vision pathways naturally. Maybe even vascular problems in the eye or other retinal disorders. You need to rule those out.
And is this common? Tunnel vision itself.
It's tricky to put a single number on it, especially UK-wide. The data's a bit limited. Its prevalence really depends on the underlying cause. So how common tunnel vision is depends on how common glaucoma or retinitis pigmentosa or optic neuritis are in that specific group of people.
I see. So how would someone actually describe experiencing this? What are the clinical features?
Well, the main thing is that restricted view, obviously. They might find themselves bumping into things.
Off to the sides.
Yeah, or having to really turn their head to scan around. That looking through a tunnel description is classic. But they can often still read or see faces clearly straight ahead.
Okay. And if they report these symptoms, what tests are done? How's it investigated?
The key test is visual field testing, perimetry.
That maps out the blind spots.
Exactly. It maps the extent of the peripheral loss very precisely. Then, to find the cause, you do a full eye exam, look closely at the optic nerve, maybe imaging.
Like OCT or MRI.
Yep, OCT for the eye structures, MRI for the optic nerve and brain. Sometimes blood tests, too, if you suspect a systemic cause.
And once you know the cause, what's the plan? Management.
It's all about treating that underlying condition, if you can. So for glaucoma, it might be eye drops or surgery to lower pressure.
Right.
For the vision loss itself, sometimes low vision aids, like special telescopic lenses, can help make the most of the remaining central vision. Mobility training, rehabilitation, that's crucial too.
Learning to navigate safely.
Exactly.
What about the long term? What's the prognosis usually like?
It's really variable. Depends entirely on the cause, how bad it is when diagnosed, and if the treatment works.
So it could get worse?
It can be progressive in some conditions, yes. Or it might be irreversible but stable. Or sometimes with treatment, you can stabilize it. It really depends.
And what are the potential difficulties, the complications?
Well, the impact can be significant, unfortunately. Mobility is a big one. Difficulty getting around, increased risk of falls, accidents,
Yeah, I can see that.
which obviously affects quality of life. It can create challenges with work, socializing. That's why rehab and support are so important.
Yeah.
So I guess the main takeaway is that tunnel vision isn't really a disease in itself. It's a symptom, a sign something's wrong along that visual pathway.
Finding that something is key.
Absolutely. That guides everything else.
It really makes you appreciate how complex seeing actually is, doesn't it? The whole system working together. Something to think about how all those different parts, the eye, the nerve, the brain, contribute to just seeing the world around you.
Well said.
If you want to dive deeper into topics like this, maybe for exam revision or just to learn more, do check out passthemsra.com.
And for loads of free resources, head over to freemsra.com.
Thanks for joining us on this deep dive today.